Embrace is quite simply the best thing that's come along to treat scars in forever. There's a plastic surgeon at Stanford, and he has spent his whole life studying scars and studying a way to mitigate scars. There were several years back where he basically quoted the term scarless healing. He found that if you take in a lab animal and a sheep, if you make simulate a cleft lip on a sheep that's in the womb developing, that you make that cleft lip and you repair it with a few sutures. At the time that that lamb is born, that cleft lip simulation has healed without a scar. So we know there's something in the womb or some environmental factor that if we could refine it, if we could spin it down and put it on wounds, that would make wounds or scars essentially invisible, or allow us to heal without scars. So he spent time doing that. Now, scars in adults many times are unsightly or noticeable because they're wide or they're raised. And that we've discovered, or he's discovered, that it's mainly due to the early tension or pull of the two sides of the wound fighting to really go back to where they were before. Many times in plastic surgery we sew things together very tightly, and there's a lot of tension. There's not much strength in that wound at that point. And so if you take the tension off of the wound, off of the skin, by giving it an external cast, which is essentially what this is. It's a tape you apply to the wound. It supports the wound. All the tension is on the tape and not on the skin. That the scar heals much softer, it heals much flatter, and it basically protects it.